Below are causes of the urge to defecate without actually wanting to defecate. 1. The frequent urge to defecate without actual diarrhea, a sensation often caused by sexually acquired proctitis, which occurs when typical sexually transmitted disease (STD) agents directly infect the rectal lining, the last 10 to 12 centimeters of the rectum during sexual contact. Symptoms like pain in the anus and the discharge of bloody mucus are often present with proctitis. In contrast, proctocolitis and enterocolitis, where inflammation extends into the colon and small intestine, can result from ingesting intestinal pathogens during oral-anal contact during sex. These conditions more commonly lead to true diarrhea. In all cases, mucosal inflammation, bleeding, and discharge are observed during visual examination. 2. The feeling of incomplete bowel movement can occur in women with chlamydial infection in their rectum. This discomfort arises due to inflammation caused by these infections, leading to sensations of rectal pain, urgency, and sometimes bleeding or discharge during bowel movements. 3. The feeling of incomplete bowel movement can occur when tumors grow in the lower digestive tract, causing stool blockage. This leads to a constant, painful urge to pass stool, even when the rectum is empty. Hematochezia, or bloody stool, and narrower stools are common signs, while anemia is rare in this condition. 4. The feeling of incomplete bowel emptying is often linked to conditions like irritable bowel syndrome (IBS) or proctitis. Another problem, fecal incontinence, occurs when you can't control bowel movements, typically due to muscle or structural issues in the rectum. Incontinence can worsen with diarrhea and urgency. Sometimes, what may seem like diarrhea is actually pseudodiarrhea, characterized by frequent small stool passages. In nursing home residents, overflow diarrhea can happen due to blocked stool. Doctors rely on a patient's medical history and physical examination to differentiate these conditions from genuine diarrhea. 5. The feeling of incomplete bowel movement can be caused by gonorrheal infection in the rectum, especially in women with cervical exudate spreading to the rectum. This infection can lead to symptoms like anorectal pain, itching, and a feeling of needing to defecate, along with rectal discharge and bleeding. The infection can be more resistant to treatment in some cases, possibly due to genetic mutations in the gonococcal strains involved. 6. The feeling of incomplete bowel movement can happen when certain bacteria invade and infect the lining of the colon. This infection causes inflammation and leads to symptoms like painful abdominal cramps, a strong feeling of needing to pass stool, and diarrhea that may contain blood, mucus, and signs of inflammation. These symptoms usually last for about a week. It can be caused by various infections, like Campylobacter, Salmonella, Shigellosis, and others, which lead to symptoms like diarrhea, abdominal pain, and sometimes blood in stool, mimicking conditions like Crohn's disease or ulcerative colitis. 7. It can occur due to radiotherapy to the rectum and sigmoid colon, leading to irritation and inflammation. Additionally, tenesmus can also result from solitary rectal ulcer syndrome, linked to problems with bowel evacuation and muscle function. It may also be associated with colitis caused by nonsteroidal anti-inflammatory drugs (NSAIDs), leading to symptoms like diarrhea and abdominal pain. 8. Appendicitis can be complex to diagnose, especially when the appendix isn't in its typical position. A rectal examination is recommended for all patients. In cases of pelvic appendicitis, patients may experience symptoms like painful urination, frequent urination, diarrhea, or tenesmus. Pelvic exams are vital for women to rule out conditions that mimic appendicitis. While there's ongoing interest in using clinical scoring systems to predict appendicitis, none can replace the need for expert clinical judgment. 9. In the case of herpes simplex virus (HSV) reactivation in the perianal region, it can cause anorectal pain, discharge, and inflammation, leading to the sensation of incomplete defecation. 10. In ulcerative colitis, the sensation of needing to empty the bowels occurs because the inflamed rectum and lower colon irritate the nerves, causing false signals of needing to empty the bowels, leading to discomfort and frequent trips to the toilet. Thanks so much for watching. Make sure to like, subscribe and share.